This is none other than Lucy, Lucy McCray, who is going to talk to us about understanding migrant vulnerability to trafficking and COVID-19 in Northern Thailand. Lucy is the Director of the Strategy at the Freedom Story, Director of Strategy at the Freedom Story, and she tries to use data and best practices to prove that prevention is possible. She's a PhD candidate again at the Liverpool School of Hygiene and Tropical Medicine, studying the causal pathways to exploitative work for children of migrants. Pleased to introduce Lucy to take over the session for the next 20 minutes. Over to you, Lucy.
Thank you so much. I'm very happy to be here. Thank you all for your time. I'm going to share my screen. Okay, can you see that on full screen?
Yes,
okay.
Yes, I can.
Wonderful. Okay, great. So I'm Lucy, and I work for an organization called the Freedom Story. The Freedom Story's mission is to prevent child trafficking in Northern Thailand, child trafficking and exploitation in Northern Thailand. We have been working in the Chiang Rai and Nan provinces of Northern Thailand for the past 14 years. And we have three main programs that we run, which are really aimed to address the underlying risk factors that put children in this region at risk. Those are an education program, which provides scholarships as well as psychosocial support for children to keep them in school and to address the isolation that they experience. A human rights program, which helps to raise awareness not only of what trafficking is, but the root causes of trafficking, as well as the way that people can access their rights with the government. This is especially relevant for people who are stateless, people who aren't citizens in Thailand, those who are migrant workers from other places, and then a sustainable livelihoods program, which is really aimed at increasing income for families living in poverty who are at risk, so that they can continue to support their children to stay in education. We have traditionally worked with ethnic Thais and the ethnic minority groups in Northern Thailand, which are called hill tribes. But in 2018, we began working with migrant workers from Burma to Thailand under the USAID Thailand CTIP project. And that experience really helped us to want to understand this new target group and how they were particularly at risk of trafficking due to their various vulnerabilities. And that went hand in hand with our ongoing desire to expand our research and monitoring and evaluation capacity. So our monitoring and evaluation process and research kind of journey really began by conducting knowledge, attitude, and practice surveys with the local population to really understand not only what they understood themselves about trafficking, but what their attitudes and practices to trafficking were as well. So once we had developed those surveys, we realized that we really had a desire to do the research in a way that was the best of our ability and to do it as ethically as possible. And that caused us to, or prompted us to kind of go through the IRB approval process with the University of Richmond, which is in Virginia, and to be sure that we were seeking ethical approval, as well as to be getting feedback from other people and other professors on the research that we were doing. At the end of 2020 and the beginning of 2021, we had an opportunity to partner with JICA, the Japanese International Cooperation Agency, in order to conduct research on the impact of COVID-19 on women and children. So both the social impact, the economic impact in how they were accessing government services, in how they were accessing healthcare. And we did that through a mixed methods process. So there was a quantitative survey, it was a descriptive survey, as well as qualitative interviews and focus group discussions with both the target population, but also key informants. So we spoke with teachers, health volunteers, village leaders, local government members to kind of get their input. And that data collection took place in both Chiang Rai and in the Nan provinces of Northern Thailand. And we actually worked with local youth and with local volunteers in the community to gather data in a more participatory way. So that was a very interesting first foray into trying to do research in a more participatory way. In the end, we did 40 in-depth interviews, 158 quantitative surveys, and we used purposive sampling in order to make sure that we were really covering our target population and to understand how they were being impacted by COVID. At the end, we had about 81% women and 19% men, with a split of about 50% ethnic Thais and 50% either minorities or migrants from Burma and from Laos. The findings we ended up with really were very reflective of what we were seeing in the wider community. So increased unemployment, as well as changes in family situations. So things like border closures, for example, for many of the migrant workers from Burma. Normally they would have sent their children back to Burma in order to be educated, and they would come back during the school holidays, but the border closures had meant that the children had stayed in Thailand. There was also a decreased income from both agriculture and daily wage labor, both of which are the main sources of income for people in the region, because it's a very rural part of Thailand. And then increased unpaid household responsibilities. So whether that was caring for older people, caring for children, again, those changes in the family situation that meant that there were perhaps more people living in the household than there were before. We also found very clearly, as you can see here on the right, that households were not equipped to study online. They were not ready for online education. When we asked them what they would need to be able to support their children to study online, about 75% said that they would need access to the internet. And as you can see in the bar chart, about 50%, over 50% said they did not know what they would need, which really, I think, reflects the status of the parents of our students, and how parents themselves have quite low levels of education, as well as very low technological literacy. So they themselves weren't sure how they would be able to equip their children to study online, but certainly lacked the infrastructure in terms of the internet, as well as the devices in order to study online effectively. We also saw very clear decreased mental health outcomes, and I'll speak about that in a moment. But probably our clearest finding was that all of these negative outcomes were especially true for migrant workers from other countries, as well as stateless individuals who were not Thai citizens, and they were disproportionately impacted by all of these issues, as well as falling through government safety nets and different government schemes that had been set up throughout the pandemic in order to sort of provide a safety net for basic needs. So here were our findings on mental health. So we asked people a range of questions, a sort of statements, things like, I feel positive when I wake up, I have things to look forward to in the day, questions that were positively phrased like that. And we asked them how often they felt those things on average. And on the left is pre-pandemic, on the right was during the pandemic. So as you can see, people were feeling positively most of the time pre-pandemic, and that had shifted to half the time or less than half the time during the pandemic itself. So obviously, as many of us have experienced ourselves, huge increases in stress and decreases in mental health and well-being overall. There was quite a few lessons learned for us out of this first piece of research during the pandemic. So the first lesson learned, I would say, would be a continued desire to develop out the capacity of the local network, so those youth and volunteers that we mentioned, to increase the participatory nature of research. So we saw an increased need for training, and also a desire from our side to bring them into the research design process at an earlier stage. We also saw that COVID was impacting risk of trafficking and exploitation among those already vulnerable populations, and we wanted to understand that more specifically. The timing of the research itself was also not ideal, so it happened right sort of in March of 2021, which was right when in Thailand there had been 0 COVID cases for around 200 days, and then in April we had our largest wave of COVID in Thailand that just kind of continued on for the next 9 or so months. So there was quite a bit of recall bias in people's responses. So had we been able to conduct the research after that second wave that was more widespread and larger numbers of cases, it's likely that some of those responses would have been a bit different. So at the end of 2021 and the beginning of 2022, we had the opportunity to conduct some more research working specifically with migrant workers in Chiang Rai and how those migrant workers had been impacted by COVID, and whether that had increased or changed their vulnerability to exploitation. So again, this was a partnership with JICA, the Japanese International Cooperation Agency. And we worked again with migrant volunteers in the local community in order to gather data and to conduct interviews. But at the same time, we were very aware that many of the migrants live with or on property provided by their employers. And so we had to be very discreet when asking sensitive questions, especially around any of the indicators of forced labor or exploitation. So we were very aware of that and wanting to ensure that we were safeguarding first before anything else. We conducted 169 interviews across 3 different districts. And again, we used a mixed methodology, both interviews and focus group discussions, as well as quantitative surveys. What we found was really that there was a pretty stark difference between the rural and urban responses around things like the knowledge of COVID practices, as well as the implementation of COVID protocols in the workplace, as well as knowledge and implementation of the government policies related to COVID, with rural areas having a much lower knowledge and lower consistency of implementation, and urban areas being much more consistent and having more knowledge. So in terms of protocols, that included things like COVID testing, as well as temperature checks, hand washing stations, and things like that. Respondents also suggested that they felt they had a lack of medical supplies in their area, especially for rural respondents. So again, that was things like masks, hand sanitizer, not being available or not as available as they would have liked. An important finding was that responses showed that migrant volunteers in the community are a really key source of both support and knowledge, that people would primarily go to a migrant volunteer first in order to find support if something had happened, if someone was unwell, rather than going to anyone in a government service or anyone outside of their community. And a lot of that was to do with the language barrier. So language barrier between their native language and the Thai language was a huge influence in accessing government services. So not being able to speak the local language held people back from interacting with local services. Again, interesting finding was that 88% of people reported social media being their key source of information around COVID. So very important to be utilizing social media in order to reach people and to do misinformation busting and provide accurate information for the community. And most of that was Facebook being the primary source for social media. When we were asking about work hours and pay, understandably, respondents were very reluctant to discuss income and working hours. These are very sensitive topics anyways. And as I said, many migrants are living in employer provided housing. So only around 45% of people answered these questions. But the responses showed that there were similar numbers of household members working before the pandemic as after the pandemic or during the pandemic for about 85% of respondents. So most households had similar number of members working, but 30% of people reported a decreased income in their within their household. So that shows that even though the number of people remained consistent, there was a decrease in the amount that people were being paid. And even for the majority of people who said that their income was the same, as everywhere, there's a bit of a cost of living crisis happening. Inflation is increasing, and this is very true in Thailand as well. In terms of exploitation or indicators of forced labor, around 22% of people reported that they themselves had direct experience either not being paid or being paid less than agreed. and around 31% said they knew someone who had had that experience. So in terms of wage theft, which was something that we were seeing anecdotally in the community, definitely something that was reported in the findings. Again, these numbers could be an underreporting based on the sensitivity of these questions. In terms of working hours, again, very few people were interested in responding. So about 36% of people chose to respond. What we saw was that the average working hours was 54 hours, which is about 6 hours over the legal limit, which is 48 hours in Thailand, or 8 hours for 6 days of the week. And interestingly, the opposite of what we saw with the COVID protocols, we saw higher levels of working hours in the cities. So the first district you can see here is the city of Chiang Rai, and then below that is the city or the large town of Mae Sai, which is in the north. And then both of those had higher working hours, and Mae Sai, you can see, has significantly higher working hours for their maximum working hours. Again, a number of lessons learned here. So a desire and a need to continue to grow the capacity of migrant volunteers to be enumerators and also to be brought into the research design. A desire to want to work through and in collaboration with migrant volunteers for both research design as well as data collection, and as much as possible for data analysis and to the dissemination of our findings as well. We were also working very closely with the Ministry of Public Health, as well as the Ministry of Human Security and Development in Thailand, and we were able to share our findings with them as well once we had analyzed our findings. So that was really exciting. They were very keen to have those findings themselves. In terms of implications for our programming, it really showed that we want to continue to expand our work on information dissemination via social media, and that it was very important to incorporate mixed media due to mixed levels of literacy within the population. It also showed us, especially with things like wage theft and the working hours, that it was important to work with employers as well as workers, so that we could, balance the power of kind of advocacy and work from both sides. And then at the end of 2021, we started our partnership with IPA and HTRI. In order to continue to grow our capacity for research, we wanted to identify local professors and researchers who had experience with anti-trafficking in Thailand, or child sexual exploitation, or working with migrant workers. And through connections with HTRI and support with HTRI and IPA, we were able to begin our partnership with Dr. Siprapa and Dr. Mark Capaldi, both of whom are at Mahidol University. And Dr. Siprapa is an expert in migrant work in Asia, and Dr. Capaldi worked with ECPAT for a number of years and ran their research department. And so he has quite a large experience with child exploitation and sexual exploitation. So we worked with them to really develop a research agenda for the Freedom Story moving forward, including collaborative formation of that agenda with our local staff. So reflecting what their interests and what's directly impacting their work and what they would like to understand more about our target population, as well as doing some research capacity for things like research foundations and, again, research ethics, making sure that we were doing our research as ethically as we possibly can and taking into consideration, the benefit and the best interest of the target population as well. So we've identified 5 key areas for potential research. So the main research questions are in the field of program evaluation for our programs, understanding how the risk factors for trafficking are changing, understanding local community perceptions of trafficking and risk, understanding the role of education in preventing trafficking, and then understanding the changing nature of trafficking due to COVID, the growth of new technologies and their influence on trafficking, as well as growing special economic zones that are along the border between Thailand and Laos, and the growing trafficking route between Thailand and Cambodia that we've seen in the last 6 or so months. So that leads me to my PhD project, which is in collaboration with the London School of Hygiene and Tropical Medicine. And that is a project that's going to be focused on understanding the causal pathways for child labor for children of migrant workers. So sort of combining a few of those research questions, looking at the perceptions of trafficking, perceptions of risk, perceptions of different types of child labor in the northern Thailand region. And, okay, as well as understanding what the decision-making process for entering child labor is. And again, that's going to be supervised or is being supervised by Anna Maria Buller and Professor Kathy Zimmerman. So I think that's my presentation for now, and I'm happy to take any questions.
Okay, thank you very much, Lucy, for taking us through your presentation and understanding the impacts of COVID on the vulnerabilities. I've been monitoring the chat, and so far we only have one question for you, Lucy. Any findings on the mental health and psychosocial support needs of children and their families affected by COVID? That is from Amit. If colleagues have other questions, please post them in the chat, or you can raise your hand. We have the next 7 minutes to discuss.
Absolutely, yeah. And if there's questions for Thierry or for other presenters, happy to have those at this time as well. So Amit, that's a great question. Thank you for asking. So as I said, we really saw significant impact on mental health due to COVID. And the findings that we had were particularly interesting because mental health is very stigmatized in Thailand still. So people are very reluctant to talk about negative mental health outcomes. But we did find that there were some significant decreases in overall well-being, people feeling significantly less positive, much more anxious, much more stressed, and the economic stress that people are experiencing now, especially with the ongoing economic impact of the pandemic, as well as rising inflation and cost of living are really significant. So I think that those are things that should not be left out of our programming when we're considering especially prevention for trafficking, how stress, shocks, and isolation can really push people to be more at risk of trafficking and more willing to engage in things like risky migration as well.
Okay, thank you. Another question from Laurel. Did the research cover any specific sectors? I joined late, sorry if I missed this.
Oh, great question. So we, children and people in our region are most at risk for sex trafficking, child labor, and then trafficking into sectors such as construction, agriculture, and a lot of that is domestic trafficking, although we have seen increases in trafficking by of ties to Cambodia and of ties to the Gulf states as well.
Thank you, Lucy. Last question that we have, did the research take into consideration the informal sector? And I'll give Prashi an opportunity after this to respond to previous questions. But for now, for you, Lucy, did the research take into consideration the informal sector?
Yes, absolutely. And I should say the research covered migrants that would be both regular and irregular migrants to Thailand. So we didn't ask people about their registration status, but we do know that in the region, there's quite a bit of both regular and irregular migrants.